Screencast, we'll talk about fractures, different terms to know when we talk about fractures, and different types of fractures. The first thing to know is that a fracture is a break in the bone. We can sometimes hear fracture and break used differently in common language, but they are in fact the same thing. A fracture is a break in the bone. There are many terms that we can use to describe fractures. The first one we'll talk about is an open or a compound fracture. Open or compound fractures break through the skin. The opposite of an open or compound fracture is a closed fracture. A displaced fracture is a fracture in which the bones slip or move so that the ends of the bones don't line up. So if a fracture is open or compound, it's going to be displaced as well because you don't normally have bones sticking out through your skin. If the ends of the bone do line up, it is a non-displaced fracture. Finally, a complete fracture goes all the way through the bone. An incomplete fracture does not go all the way through the bone. When we look at what it takes to break a bone, we're going to talk about a stress-strain curve only at a very basic level. On the y-axis, you can see stress. This is the force that is placed on a material, in this case, the bone. On the x-axis, you can see strain. That is the deformity or the change in the material as the stress is placed upon it. So what you can see happening here, there are different names for all these different regions, is that the bone, in this case, will be able to absorb a bunch of force, but then it actually starts to deform and change a little bit until the point E here is the fracture point, at which case it breaks. So the important thing to take away from this graph here, without understanding all the different details of it, is that a bone or any material can absorb a certain amount of force before it gives way. When we talk about the amount of force that a bone can handle before it breaks, there are different types of fractures. So the first cause of a fracture is a traumatic or acute fracture. In this case, there is an instantaneous force, so the force is all at once, and that force is greater than the bone can withstand. So this is an immediate force, all at once, that's just greater than the bone can withstand. When we look at a stress fracture, this is gradual stress that is applied to the bone, usually over time, that causes a break. A stress fracture can cause the bone to be weaker because you have these little stress fractures, and they can then turn into traumatic or acute fractures if there is an instantaneous force greater than the weakened bone can withstand. And speaking about weakened bones, we also have pathologic fractures. In pathologic fractures, there's an underlying structural defect, a disease, or a disorder that made the bone weaker. So that stress-strain curve we just looked at would be a lot flatter. This could be something like having a tumor in the bone, or it could be a disease that causes calcium to be absorbed poorly, or it could be something like osteoporosis, in which the bone density is a lot less than it could or should be in order to be a nice, strong bone. Here are some different types of fractures. These aren't all the types of fractures, but it's a good representation of them. When we look at these different types of fractures, you'll see the fractures go in different directions. In some cases, they have different causes, different age groups, etc. So we'll go through them fairly quickly, and we'll also use the other terms we learned, such as displaced and non-displaced, open versus closed. First one we have is a transverse fracture. A transverse fracture runs at a right angle to the axis of the bone. In the left picture, you can see there's a fractured humerus, and in the right picture, you can see a fractured femur. In both cases, you can see that these are complete fractures. They go all the way through the bone, and they're also displaced. The ends do not line up. They're also both closed fractures. There is soft tissue. You can see this lighter shading here is soft tissue in both cases. So it doesn't go all the way through the skin, but they are both complete and displaced fractures. Next, we have a linear fracture. And linear fracture is an incomplete longitudinal fracture, so it goes along the axis, or we often see them in skulls as well. Oblique fractures occur at any angle other than a right angle to the axis of the bone. So you can see here that is a tibia and a fibula that are both complete fractures. They are oblique fractures, and you can see that they're also displaced. They don't line up the way they should. And here, it is very close to being an open fracture, but it is not. A spiral fracture is caused by excessive twisting of the bone. So this fracture is a little bit interesting in that twisting causes it to break in a spiral. Kind of like when you crack open a can of Pillsbury biscuits, or you're going to make pigs in a blanket, and the can, when you pop it open, twists, and so it goes around in a spiral. Same kind of thing. So when you look at an x-ray here, the more dense something is, the brighter white it'll show up. So if we're looking at the diaphysis, we can see that this part of the diaphysis has more density than this part. And the reason is because here, it's the full circumference of the diaphysis. Here, it's only half the diaphysis, and then the other half of that part of the diaphysis is over here. So that is a spiral fracture. A green stick fracture generally occurs in children, and it's named after what happens if you try to snap a green stick. So if you go outside in the middle of winter and find a little twig on the ground and snap it, it will snap pretty easily. If you go out in the spring, when everything is newly green, and you take a little branch off a tree and you try to snap it, it won't really snap. It'll kind of bend on one side and splinter on the other. And that's a green stick fracture. So in a green stick fracture, it bends on one side, which causes some splintering, incomplete fractures on the other side, the convex side. Again, this usually happens in children because children have kind of bendy bones. Next, we have a comminuted fracture. This is a complete fracture, but it leaves fragments of bone. So it's not a very clean fracture. It's kind of all over the place. You can see when you look at it here, there are lots of pieces all kind of shattered within there. They often need plates and screws. Next, we have an avulsion fracture. An avulsion fracture is caused when the bone is actually a little bit weaker than the muscle or the tendon. So the muscle or tendon will actually pull the bone away from pull part of the bone away from the rest of the bone instead of damaging the tendon or the ligament. Lastly, we have epiphyseal plate fractures or growth plate fractures. These can only occur when you still have open epiphyseal plates, and they can affect long-term growth. So we usually need to repair these. You can see these are 5 different types according to the Salter-Harris classification of epiphyseal plate fractures. And you can see in some cases the diaphysis is on one side and the epiphysis is on the other. Sometimes there's parts of one and not parts of the other. It goes all the way through all of them, or the last one is a crush fracture where you actually crush the epiphyseal plate. So that is a quick overview of fractures, the different types of fractures specifically, and then also general terms that we use when describing fractures.